We'll now have one more reading of a passage from the book. And I'm going to request Dr. Hemanth Vudayaraju, who has a journey very similar to Dr. Chinnababu Sunkavalli. I believe they studied together. I believe they roomed together. They were inspired by each other, joined the hospitals together, and he is also a robotic oncology surgeon with the Yashoda Hospitals, Secunderabad. And thank you very much for agreeing to be here and read this passage for us. Thank you very much.
It's pretty humbling to be here. So I don't know if Chinna remembers, 19 years ago, on a very sultry August afternoon was when we first met each other. We had just taken a national level entrance and we both scored ranks 1 and 2. We were waiting for the counseling. So this was in Ahmedabad, August 2004. So I had come here from all the way from Telangana, and in fact there's one gentleman who we were combined Andhra Pradesh then. So there was one gentleman, only one contact I had in Ahmedabad. He was very happy that all the way from Telangana you actually come to write an entrance. That itself is a victory for us. It's a different matter that you're in the top ranks. So with this gentleman's help, I just went to the counseling center, and generally we were that which seat to take and all that kind of anxiety was there. Found one chap who was pretty comfortable with everybody, with speaking fluent Gujarati. So I thought probably this guy is a local guy. And then I said hello to him. He says, right, what are you taking? Which branch are you taking? So I'm taking surgical oncology. Ahmedabad, urology is one of the topmost in the country. Normally, the top rankers go for urology. But we both had some different line of thought, and thought process was different. So he said, I am also planning oncology. I said, where are you from? I said, I'm from Karnataka, but I heard you speak good Gujarati. I said, I've done my MS here. We both come from very diverse backgrounds, completely different journeys. My journey is absolutely opposite to what Chinna had in his initial years, which you will go through in the book. But the very minute that we spoke to each other, we realized that there is something very common in between us. We both took surgical oncology. We were roommates for 3 years. Since then, I don't think there's a single day, correct me if I am wrong, on which we don't speak to each other. We have our journeys together, been a part of Grace. Every patient that is on table, if I have a problem, my phono friend is Chinna. And if Chinna has an issue, I am the phono friend. So it's been a journey, but I have limited myself to a small sphere of only taking care of patients. Chinna has ventured further to take care of the community, which is a rarity among doctors. We're very obsessed with our patients, the disease, the treatments and all, but very few actually have it in them to go out of the working hours, to go to the community and tackle the disease at the level of its origin on a preventive care. And he's what all I could not have done. What all I cannot do, Chinna is doing it for me and for all of us. The passage that I'm going to read talks about our professional mother, Dr. S. Visha Shekuntala Virensha. She is a pioneer oncosurgeon, a lady. Normally, ladies don't come into this branch, but she is a pioneering oncosurgeon. Such levels of skill, commitment, and I would say oncosurgeons, we require a lot of valor. The things that we do put our patients on the brink of death and get them back. She's one surgeon that we would dread to assist because she would push the limits to certain levels to get the patient back and give them a normal life. So this is a passage in the book that I am reading. This is a conversation between Chinna and Shekuntala madam. I quote, I saw Dr. Shekuntala as a role model for a cancer surgeon, especially in handling the trauma of breast surgery. Women make up about 10% of the 10 surgical specialties, although they make up 1/3 of medical schools and 1/4 of all practicing physicians nationwide. The lengthy, difficult training required to become a surgeon and the demanding, rigid hours required of the profession might conflict with having and raising children. Unquestionably, long-term survival after surgery for breast cancer depends upon the stage of cancer when it is removed. However, after witnessing Dr. Shekuntala's practice, I could link survival to performance measures. Survival is greater at hospitals that routinely perform breast cancer surgeries. So, quote, can one infer that breast-focused surgeons are more competent? I once asked Dr. Shekuntala, unquote. Without a trace of ego, a true embodiment of humility that she is, she told me that any improvement of survival is due more to the multimodality strategy of treating the disease rather than a surgeon's technical or professional judgment. How many surgeons would ever say that? It was at GCRI that I met Dr. Somshekar, a surgical oncologist, who became my mentor, and Dr. Hemanth, who became my third brother, unquote. Chinna, I thank you for actually getting me here, allowing me to share your journey with you. It, I think, is providence and nothing short of grace of God that we have met. We have been roommates, we have shared all our troubles, we have been there for each other, and I hope you outlive me and you continue to do what all I wanted to do, but I am not doing. Right? And one last word. We have eminent achievers here, people from all walks of life, people who have had great achievements in their worldly journey, in their multiple achievements that they have. Chinna is one person with each and every journey and his outward worldly milestone, he attaches it to his inward journey. He finds himself in every achievement that he does, which is done very consciously. And if you have noticed, that fear of doing harm, the fear of stepping on the wrong path is something that should be a guiding force to each and every one of us. As doctors, the first principle is primum non nocere. In the sense like, firstly, we do no harm. And that very, very, very few people actually understand and practice. He is one of them.
Thank you.
Thank you.